Your Cellaed comes with a user manual and 3 magnetic quick start guides. Your Cellaed is a single-use device and should remain within the protective packaging until required to treat sudden cardiac arrest. The user manual explains everything you need to know about caring for and using your Cellaed. Important sections include where to store the Cellaed, how to conduct a monthly inspection of the Cellaed, how the Cellaed works, and steps to follow to use the Cellaed to treat sudden cardiac arrest. Pay special attention to dangers, warnings, and cautions throughout the user manual. The Quick Start Guide magnets can be placed on your refrigerator to remind you of important information about sudden cardiac arrest. The first guide describes how to identify a sudden cardiac arrest and how it differs to a heart attack. A person in sudden cardiac arrest will be unconscious, unresponsive, and not breathing normally. This is the right time to use the Cellaed, but always call emergency medical services. The second guide describes the steps you need to take if someone is in sudden cardiac arrest. First, call emergency services, then apply chest compression CPR, and if the patient does not recover, retrieve and use the Cellaed and follow the audio prompts. Write your local emergency services number and the address of the Cellaed location in the spaces provided, so this information will be readily available to provide to emergency medical services in the event of a sudden cardiac arrest or other emergency. The third guide indicates that there is an automated external defibrillator nearby and includes space for you to write where your Cellaed can be found within the premises. Your Cellaed should be stored somewhere that is easily visible, easy to access, and easy to remember. Keep it away from moisture, dust, and extreme temperatures, as temperatures below 15 and above 35 degrees Celsius will reduce the life of the battery. You can attach the Cellaed to the wall in a central location, or stick it on the refrigerator on the hinge side of the door where opening and closing forces are reduced, or you can position the Cellaed near other emergency equipment such as fire extinguishers or first aid kits. It can be useful to have a razor available near the Cellaed location, but shaving of chest hair is only required when applying the Cellaed to excessively hairy skin. The Cellaed does not need any technical maintenance, but you do need to check it once a month to make sure that the tamper-proof seal is intact and there are no cracks, leaks, or other signs of damage. The Cellaed performs a self-check every month to make sure the device is ready for use. The LED indicator will blink green when the device is fully operational and ready to use. The LED is red when administering a life-saving shock. If the LED blinks amber, this indicates that although the Cellaed can still be used, the battery is low. The absence of an LED color indicates the Cellaed battery is flat and the device needs immediate replacement. Retrieve the Cellaed from the protective packaging by grasping and pulling the tab to break the tamper evidence seal. Peel off the tape seal to open the protective case and remove the Cellaed. Holding the Cellaed firmly in one hand, use your other hand to tear the protective bag open where indicated on the bag. Remove the Cellaed from the protective bag. You will note CPR pictorial guides on the inside of the Cellaed case. It will be useful to keep the case and these CPR guides on hand. The Cellaed is an automated external defibrillator and can be used to treat sudden cardiac arrest in people of all ages. The Cellaed device is activated and applied with simple snap, peel, stick actions. The associated process only varies for patients weighing 10 kilograms or 22 pounds or less. Children under the age of 1 year are likely to be within the infant weight range, but knowing the weight of a child in your care can be helpful. We will show you the infant variation later. Sudden cardiac arrest occurs when an electrical disruption prevents the heart from pumping blood around the body. When someone is in cardiac arrest, they are unresponsive, unconscious, and they stop breathing or take ineffective, abnormal breaths. If you think someone is in cardiac arrest, first check the area for any danger to make sure it is safe for you to provide chest compression CPR and use the Cellaed. Move them to a safer area if you need to, or if they are lying in a pool of water or another electroconductive material or surface. To check whether someone is in cardiac arrest, loudly call their name or attempt to attract their attention. If they do not respond, shake them gently. Check for breathing by looking for rhythmic, regular rise and fall of their chest. If they remain unconscious, unresponsive, and not breathing normally, you need to take action quickly. Sudden cardiac arrest can be associated with agonal breathing, which is not normal breathing. If you're alone and responding to sudden cardiac arrest, call emergency services immediately. If the Cellaed is close at hand, retrieve it and prepare to provide chest compression CPR. If there are other people nearby, attract their attention, ask them to call emergency services and bring you the Cellaed while you start CPR. To give chest compression CPR, place the heel of your dominant hand on the center of the patient's chest. Place the heel of your other hand on top and interlace your fingers. Position your shoulders directly over your hands and keep your arms straight as you push down hard enough to compress their chest by 2 inches. Provide 30 compressions at a rate of around 2 per second. If the patient remains unconscious, unresponsive, and not breathing normally after 30 chest compressions, prepare to use the Cellaed. The Cellaed electrode gel pads need to adhere to the patient's skin as closely as possible to the chest wall. Quickly and forcefully remove the patient's clothing, including any undergarments if necessary, to expose their chest. Do not be afraid to tear or rip clothing if necessary. A sudden cardiac arrest is a medical emergency and not a time for modesty. You may also need to lift excess skin or breast tissue in order to correctly place the gel pads on the chest wall. Remove any necklaces or other jewelry, medicine patches, or any other electronic devices that don't have the defibrillation protected mark, as they can interfere with the effectiveness of the Cellaed. If their chest is dirty or damp, wipe the chest with any clean fabric on hand. Retrieve the Cellaed from the protective packaging by grasping and pulling the tab to break the tamper evidence seal. Peel off the tape seal to open the protective case and remove the Cellaed. Holding the Cellaed firmly in one hand, use your other hand to tear the protective bag open where indicated on the bag. Remove the Cellaed from the protective bag. You will note CPR pictorial guides on the inside of the Cellaed case. It will be useful to keep the case and these CPR guides on hand. To activate the Cellaed, perform the simple snap, peel, stick actions. Hold the Cellaed with 2 hands with the pictorial instruction label facing toward you and electrode gel pad liner labeled this side facing down or away from you. Snap the Cellaed in half along the center line by applying downward pressure. This separates the 2 electrode gel pads which are connected by an electrical cable. The snap also activates the device and the audio prompts that will guide you in using the Cellaed.
Call for help. Remain calm.
Separate the 2 pads to extract the cable and peel away the protective liner completely. You may need to apply 1 electrode pad to the patient before manually removing the remaining liner from the other pad. It is important to completely remove the liner to ensure each electrode gel pad is fully exposed. Discard the liner when completely removed. Stick 1 pad firmly onto the patient's bare skin at the top right-hand side of their chest and stick the other pad onto the bottom left-hand side of the chest. When placed correctly, the cable of the Cellaed should be aligned with the patient's nipples where it exits the device. Press firmly and make sure that the entire surface area of each pad adheres to the patient's skin. The Cellaed can be applied to the chest no matter which side of the patient you are on. Your right arm will always extend across the patient while you place the electrode pad in your left hand on the patient's side closest to you. If the patient has a pacemaker which looks like a raised bump under their skin, stick the top right-hand pad at least 2.5 centimeters or 1 inch away from the bump. Never stick the pad directly over the pacemaker, as this will reduce the effectiveness of the Cellaed. Follow the audio voice prompt instructions as directed and do not touch the patient unless instructed to do so. The Cellaed will analyze the patient's heart rhythm, and if it determines that a shock is needed, the audio prompt will announce "shock advised" and then instruct you to stand clear for shock. The Cellaed will not deliver a shock unless it is required.
Shock advised. Stand clear for shock.
It is very important that you do not touch the patient, the electrodes, or anything in contact with the patient when you hear these messages, because this can reduce the effectiveness of the heart analysis and shock, and will also be uncomfortable for you. The Cellaed will administer a shock and reanalyze the heart rhythm as required.
Shock delivered.
Follow the audio prompts when they instruct you to apply CPR. The Cellaed will play a CPR timing beep to help you to provide compressions at the correct speed. Keep following the audio prompt instructions to provide CPR and stand clear for heart rhythm analysis and shock until the patient recovers and is breathing normally. It is also safe to stop when a healthcare professional instructs you to stop or is ready to take over, or it is no longer possible, reasonable, or safe for you to continue. If the patient starts moving, coughing, or breathing regularly, place the patient in the recovery position and keep them as still as possible until emergency services arrive. In the event that the Cellaed or other AED being used is unable to revive a patient in an emergency situation, it is important to continue CPR where possible and safe to do so until emergency medical services arrive. When you are finished using the Cellaed, remove the gel pads by peeling them from the patient's chest. Press the gels of the two pads together for at least 5 seconds to shut down the Cellaed defibrillation function and audio prompts.
Device deactivated.
A child weighing 10 kilograms or 22 pounds or less is considered an infant. On average, children under the age of 1 year fit in this weight range. Knowing the weight and age of a child in your care can be helpful. For all other children over 1 year of age, the Cellaed and CPR application processes should remain the same as for the adult. But for children under 1 year of age, the Cellaed and CPR application processes differ in a number of ways. Do not shake an infant in sudden cardiac arrest. Instead, gently tickle them under their feet or arms while attempting to attract their attention. If you did not see the infant lose consciousness, first apply chest compression CPR before calling emergency services or fetching the Cellaed. Remove the infant's clothing to expose the chest and place 2 fingers in the center of the chest. Push down to a depth of 1/3 of the infant's chest at a rate of 100 to 120 compressions per minute for 60 seconds. In order to apply a Cellaed to an infant's chest, place the electrode pad with the blue button in the center of the infant's chest. Grasp their right shoulder to roll them over and place the other pad in the center of the infant's back. Then return the infant to their back. When instructed by the Cellaed audio voice prompts, firmly press the blue button labeled Press for Infant Use Only. When instructed to confirm your selection, press the button a second time.
Infant mode enabled.
Continue to follow the Cellaed audio voice prompts and apply CPR when prompted. In order to continue CPR, it is important to remove the Cellaed gel pad from the front of the infant's chest. Lay it gel pad side up alongside the infant before applying chest compression CPR with 2 fingers in the center of the infant's chest. The Cellaed gel pad can be returned to the infant's chest when required and prompted. Continue to follow the Cellaed audio voice prompts and apply CPR until emergency medical services arrive. Remember, your Cellaed should be stored somewhere that is easily visible, easy to access, and easy to remember. Keep it away from moisture, dust, and extreme temperatures, as temperatures below 15 and above 35 degrees Celsius will reduce the life of the battery. Your Cellaed must remain in the protective packaging until it is required during a sudden cardiac arrest event. Sudden cardiac arrest is different to a heart attack. A person in sudden cardiac arrest will be unconscious, unresponsive, and not breathing normally. Call emergency medical services. Clear the patient's chest to enable application of the Cellaed. Retrieve the Cellaed from the protective packaging by grasping and pulling the tab to break the tamper evidence seal. Peel off the tape seal to open the protective case and remove the Cellaed. Holding the Cellaed firmly in one hand, use your other hand to tear the protective bag open where indicated on the bag. Remove the Cellaed from the protective bag. You will note CPR pictorial guides on the inside of the Cellaed case. It will be useful to keep the case and these CPR guides on hand. After removing from the protective packaging, activating and applying the Cellaed is as simple as snap, peel, stick. The gel pad liner may require some manual removal. Your right hand will always extend across the patient's body while your left hand remains on the side closest to you. For infants, you need to place the pad with the blue push button on the front of the chest and the other pad on the infant's back. You will be prompted to push the infant button and again to confirm. You will need to remove the front gel pad from the infant's chest to apply chest compression CPR with 2 fingers in the middle of the chest. Be sure to lay the pad gel side up beside the infant to prevent a loss of gel adhesion. Keep following the audio prompt instructions to provide CPR and stand clear for heart rhythm analysis and shock until the patient recovers and is breathing normally. It is also safe to stop when a healthcare professional instructs you to stop or is ready to take over, or it is no longer possible, reasonable, or safe for you to continue. In the event that the Cellaed or other AED being used is unable to revive a patient in an emergency situation, it is important to continue CPR where possible and safe to do so until emergency medical services arrive. When you have finished using the Cellaed, remove the gel pads by peeling them from the patient. Press the gels of the 2 pads together for at least 5 seconds to shut down the Cellaed defibrillation function and audio prompts.